of COVID-19. The chairman of Presidential Task Force on COVID-19, our ministers, and members of PTL, our esteemed viewer and listener back at home, our reporters here in the hall, and those in various remote locations who have tied in to join us. Today is Monday, the 18th of January, 2021. On behalf of the PTF, I want to welcome everyone to today's national briefing. At this point, may I please invite the chairman of PTF and the secretary to the government of the Federation to make his opening remarks. SGF, please.
Press. Let me start by apologizing for our inability to start the press briefing by 5 o'clock. We had a lot on our plate. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Monday, the 18th of January, 2021. You will recall that at the last national briefing, we unveiled the new schedule of briefings, which shall now hold every Monday of the week. You will also recall that the Presidential Task Force had informed you of the resumption of schools nationwide, that would be reviewed due to the rising daily numbers of infections and the challenges of case management, especially the shortage of oxygen, so that we do not allow our facilities to be overwhelmed. While we note that several states have proceeded with the resumption of schools, the PTF recommends strongly that very strict adherence to non-pharmaceutical interventions should be enforced by the states to avoid the escalation of cases. The Presidential Task Force will continue to dialogue with the governors and the Federal Ministry of Education to closely monitor the situation and, if need be, review that decision. The snapshot of our nation as at 17th January 2021, which ought to guide our decisions and approach, is as follows. Cases recorded so far, 110,387. Active cases, 22,156. That's about 20.34%. Discharged, 89,317, representing 78.36%. Fatalities, unfortunately, 1,435, about 1.30%. Tests conducted so far, 1,172,234. And the spread of the virus is in all 36 states plus the Federal Capital Territory. I wish to note particularly, however, that in week 2 of 2021, the statistics reveal the following. Cases recorded 10,300. Deaths, unfortunately, rose to 77 in number. Active cases, 19,635, just in 1 week, week 2nd. All these numbers represent increases compared with the numbers from week 1 of 2021. The DG, Nigerian Center for Disease Control, will elaborate on this. On the African continent, South Africa and Nigeria continue to report highest daily count, while South Africa, Ethiopia, Nigeria, Algeria, and Kenya account for 76% of all cases in the region. Nigeria has moved up to 3rd position in highest cumulative case load, but remains 2nd for new cases and 5th highest in cumulative deaths on the World Health Organization African region. From the foregoing, testing has proved to have become more significant in our national response. The Presidential Task Force still urges the state governments to enable their EOCs to step up on sample collection and to maximize the capacities of the PCR laboratories already established in their states. The Presidential Task Force has also authorized the Nigerian Center for Disease Control to immediately implement the 450 tests per local government plan nationwide immediately. We are aware that states are not on the same pedestal in the area of testing. We shall begin with states that are in the forefront of resourcing and infrastructure. So not all states will be on the same page. The Presidential Task Force wishes to emphasize the need for all segments of the society to get involved in risk communication, community engagement, in our continued collaboration with the religious and traditional rulers. We align with the statements issued by the Christian Association of Nigeria, CAN, guiding the sick and the elderly on the need to avoid large gatherings by staying at home. We are optimistic that other institutions will follow suit as we progress. The positive news about vaccines remains high in the ranking of discussions nationwide. Nigerians are assured that the PTF will ensure that the vaccines to be approved will be safe and effective. We must, however, work together as foot soldiers in the vaccine advocacy so that we can eliminate the pandemic. The PTF wishes to emphasize that the success of our national response shall not depend on vaccines alone. Rather, compliance with the non-pharmaceutical protocols must remain top on our individual priorities. We are making progress with case management under our national response. The national response continues to receive the support of the private sector in the delivery of medical oxygen to the various facilities. At the same time, funds for the rehabilitation of existing oxygen facilities have been released to the various institutions, particularly the ones in Abuja. There is also in process and in motion to ensure the construction of at least one oxygen facility in each state of the Federation. Before I close, let me remind you that the pandemic is raging and all tiers of government and citizens must keep their hands on deck. We are in a difficult situation in which a balance must continue to be struck between lives and livelihood. We are considering all options while hoping that broad cooperation will be received from our citizens. We must do everything possible to avoid a second lockdown in Nigeria. Finally, the Presidential Task Force is proceeding with the next phase of the approved presidential sanction against all inbound international travelers that fail to undergo the 7-day post-arrival test. The Presidential Task Force will publish the next list of 100 defaulters very soon. Let me clarify, however, that there is a strong multi-sectoral approach to activities, decisions, and engagement of the Presidential Task Force with institutions of government and the public. Consequently, all steps being taken are outcomes of in-depth consultations and review before they are made public. I now have the honor to invite the Honorable Minister of Health, followed by the DG NCDC, and thereafter the representative of the National Coordinator to update you on these other technical aspects of the briefing. I thank you for your listening and have a wonderful evening. Thank you.
Directors General, Permanent Secretaries, representative of the National Coordinator, ladies and gentlemen of the press. The number of new COVID-19 cases has continued to rise in Nigeria, such that we confirmed 10,300 cases from just 50,750 samples tested in 1 week, translating to 20% positivity rate, which means that 1 of every 5 persons tested last week turned out positive, compared to the previous week, which had a positivity rate of 14%. Our total number of confirmed cases stands, as already said just now, at 110,387 of a total of 1.172 million samples tested, with a cumulative positivity rate of 9.4%. 1,444 cases were recorded in the past 24 hours, with sadly 77 deaths in the past week, and total fatality of 1,435. It is instructive of the second wave of COVID-19 that all cases recorded so far in January make up about 20% of all confirmed cases we have in Nigeria, more than the whole of December, and barely halfway through the month. There is no question that we are deeply into the second wave of the pandemic, which requires that the PTF and Federal Ministry of Health will review strategies to respond to the challenge and take additional necessary measures to check this case deluge that can threaten our health system's capacity to cope. Federal Ministry of Health is outlining 3 approaches to confront the pandemic. The first being the infection mitigation, which we have been doing up till now, which we intend to strengthen. Second being therapeutics, and the third being the vaccines. Reducing infection rate for COVID-19 remains the easiest, cheapest objective of government, whose main effort is to ensure social mobilization for testing, strengthening surveillance activities for early detection, active contact tracing, isolation and treatment, risk communication. However, implementation of the critical non-pharmaceutical measures requires much more cooperation from the public. Therefore, we expect more adherence to wearing of masks, social distancing, use of sanitizers, etc., much more than we are seeing today. Social distancing is of special concern, especially with regard to the risk of so-called super spreader activities that involve congregational settings, which must be reduced, restricted, or perhaps even prohibited in the interest of the common good. With regard to therapeutics, we are striving to reduce mortality from the disease by ensuring adequate stock of supplies and strengthening our case management capacity. Case fatality has dropped to about 1.3%, but that is no comfort given the volume. And in this regard, the Ministry of Health is working to expand oxygen availability across the country, as strategized by the PTF, to address shortages which have been a challenge globally, and also to review the value of various pharmaceuticals and protocols proposed for COVID-19 treatment. Clinicians are urged to work out guidelines for participating in clinical studies for ivermectin, which is in the news presently. The Honourable Minister of State and I joined in the virtual meeting of the Federal Ministry of Health Case Management Pillar a few days ago, which provided us an opportunity to actually interact with those out in the field managing cases in the isolation centers. Gaps and challenges were identified and they are clearly being addressed. Such meetings are held regularly to ensure quality of care in our treatment centers, and also to provide a platform for case managers to compare notes with each other on treatment approaches. The clinicians have been advised to respect the national interim guidelines for management of COVID-19 cases, bearing in mind their discretion, clinician discretion as novel treatment options are evaluated. I want to use this opportunity to appreciate the effort of our frontline workers for the great work they are doing in the face of all these challenges, which we are handling as well as any other country. I assure you that government will provide all necessary support to facilitate quality care at all centers. On vaccines, we are exploring all options available to us for the acquisition of approved vaccines for Nigeria. We are hopeful that our arrangement with COVAX to provide the first consignment of vaccines will work out soon if they arrive in the country within the next few weeks. But apart from this COVAX facility, which is built to cover 20% of our population, we plan to increase our chances of getting enough vaccines to meet the country's need to cover an additional 50% of the population. Nigeria is participating in the African Union initiative called African Vaccine Availability Task Team, which reports directly to the African Union chairman, the President of South Africa, and has secured 270 million doses of various vaccines for Africa. Bearing in mind the options suitable for our environment and our available infrastructure, as well as investment in delivery, Nigeria has written to express interest in 10 million doses of this viral vector vaccine, which could be supplied possibly from March 2021. Preparation for COVID-19 vaccine requires that countries determine criteria for prioritization and develop a robust vaccine distribution strategy, and also identify vaccine administration sites and teams, which the NPACDA is doing very thoroughly at this time. It also requires that countries develop a procurement, supply chain, and distribution plan for commodities and devices that will be used along for the vaccines, as well as a sustainability plan. We are already working on that for the time when vaccines begin to arrive. Tomorrow, the 19th of June, the Federal Ministry of Health will organize a national vaccine conference as part of our preparations to mobilize our experts, role players, development partners, and stakeholders to create a unified and strategic front for the provision of vaccination of Nigerians against COVID-19. The conference will also provide a platform for deliberation on our COVID-19 response strategy, especially at this time of spiking cases. We shall engage all Federal Ministry of Health agencies, especially NAFDAC, NCDC, state governments, religious, traditional community leaders in plans for vaccine rollout, since their role is critical to the orderly and successful deployment. We must also be able to reach out to those eligible to receive vaccines anywhere in the country. The Ministry of Finance has released 10 billion naira to support domestic vaccine production. While we are working to develop our own vaccines, Nigeria is exploring options of licensed production in collaboration with recognized institutions, and we're also exploring the option for local production of vaccines. We are in discussion with one or two producers already through the government's own BioVaccine Limited. There are reports of claims by some persons in Nigeria to have the COVID-19 vaccine for sale within our country here. I advise all citizens to disregard these claims. They are not genuine. Some of them may be criminal. There are procedures for vaccine acquisition and use, which include appropriate regulation and certification by NAFDAC. I advise against fake vaccines, as there is no vaccine approved yet for use in Nigeria, And the National Primary Healthcare Development Agency is the only authorized vaccine administrator in Nigeria. No other person or group should be given this injection. Finally, I want to remind all that the prospect of vaccines arriving soon is cheering, but the importance of the non-pharmaceutical measures remains critical to prevent infections. You are not free from the day you start getting vaccines from non-pharmaceutical interventions. Non-pharmaceutical interventions have to go hand in hand with vaccines for a very long time. So therefore, wear your mask, wash your hands regularly, use sanitizers, avoid close contacts, avoid crowded places, and if you have symptoms like cough, difficulty in breathing, sudden loss of taste and smell, or if you have a fever, please get tested. Again, let me repeat that the availability of vaccine does not mean the end of other measures that we are taking. Thank you for your attention.
Secretaries, WR, my colleagues, gentlemen of the press, good evening. Today, the 18th of January, in the last 1 week, we have continued our response activities across the country. Last week, across the country, 100,000 tests were carried out in Nigeria, the highest number of tests done in a single week since the beginning of the outbreak. So the response continues. We extended the deployment of teams to many states, to Kaduna State, to Plateau State. They have been there since the Christmas period, since the beginning of the second wave. Like you know, we've also announced a new short code, 6232, through which members of the public can reach the NCDC Connect Center free of charge. This has been supported by the Nigerian Communications Commission, so we're very grateful to our colleagues that worked with us over a 5 to 6 month period to make this happen. But finally, we have it. It's also interconnected with all the other emergency lines that we have, the 112 line. So 6232, the old 0800 number is still functioning. We'll keep it for a few more months because many of you have it saved on your phones, but we will eventually all migrate to 6232. However, my main focus today will be on the role of the private sector in Nigeria's COVID-19 response activities. In the first area I want to talk about is the deployment of rapid diagnostic test kits. Firstly, I'd like to announce that we have now developed some new guidance on the use of rapid diagnostic tests in Nigeria, targeting primary congregate settings. So schools, workplaces, NYSC camps, you know already, military camps, wherever people gather together, we're going to be deploying the use of RDTs. We've started the rollout specifically in hospitals today. In 5 tertiary hospitals are being consulted with in FCT today. The 3 federal establishments and 2 state tertiary hospitals, Maitama and Asokoro. Our goal is to roll this out to all tertiary hospitals in Nigeria from February. But these guidelines are not just for our procurement. We're also encouraging state governments, the private sector, whoever wants to deploy them. These guidelines are now available on our website. It gives you very in detail, a lot of details on what RDT tests to procure, the process for testing, how you need to set up the infection prevention and control standards you need to use if you're using it, the minimum personnel involved, the data flow, and critically, we have an algorithm to use in terms of how to interpret the test and how to link back into PCR testing if it's needed. So we think that with the deployment of rapid diagnostic test kits broadly in Nigeria, we will rapidly even further scale the testing in Nigeria and make sure we find as many cases as possible and link them into care. In addition, you will remember that when we started this response, we had 4 key strategies on testing. One was the open PCR platforms, which we have enabled their deployment across the country. Secondly, were the high throughput labs that were serving the HIV program for many years. Thirdly, was the deployment of gene expert labs, testing facilities primarily used for TB, which we now converted for COVID with some adaptations. And thirdly was the role of the private sector labs. Now, you recognize that in many countries like Nigeria, the private sector actually provides a significant proportion of essential healthcare services altogether to the population. So between January 2020 and 2021, we have activated in total 112 labs with the capacity to test for COVID in Nigeria, 112 so far. Of these 112, 74 are public sector labs owned and fully funded by various arms of government, while 38 are in the private sector. 33 are completely private sector labs, while the others are kind of part of corporate labs, such as NNLG, Total, all have supported labs that are also serving the population communities around them. Unfortunately, we have not fully optimized the capacity we have in our private sector yet. Several countries have also devolved testing to the private sector largely. If you look at South Africa, 60% of all the tests done right now, done all together since the beginning of the outbreak in South Africa, are done by private sector labs. So we have to push a little bit harder. In Nigeria, 30% of our over 1 million tests have been done in the private sector. And the public sector obviously still bears the burden of testing. And we think, yes, there are people for whom we will consistently develop the public sector testing. That will continue to happen. But the private sector can serve also a large part of the population, as it has done for many years and for many other conditions. So the rising number of COVID-19 cases and the need for testing provides an opportunity for the private sector to get more involved. So what we have done is created a framework for effective private sector participation. We have developed a framework exactly how you get tested. We will come and support your activation for free. We'll send a team anywhere in the country to support you if you want to set up a private lab. At the moment, of the 33 private labs in the country, 18 are in Lagos alone. 18 are in Lagos, 9 are in the FCT, and the other few labs are set up in only 5 states. We want to broaden this, and we're calling on the private sector to take on this challenge, set up these labs. Yes, we're working very hard to get vaccines into the country, but there will be a consistent need for testing for the next year or two, and probably even into the future. So there's a real opportunity for you to support the work being done by the federal government. So as we continue to scale, there's an opportunity for the private sector to get involved, support the work we're doing to make testing more available to every Nigerian. The final area I wanted to touch on a bit was on the reopening of schools. The Federal Ministry of Education has led of this, obviously, and has worked very hard. Understandably, there's been a lot of anxiety across the country today as children return to schools in many states. In addition to my role in NCDC, I'm a parent, and this morning too, I saw my 2 children start school with the same anxieties that any other parent would have had today. But it is important to remember that there's no such thing as no risk. Risk is always about mitigation. There's no perfect solution. We have to manage risk. Every day we wake up to go to school, to go to work. When we go to church, when we go outside, there are risks involved. The challenge is how do we manage that risk and how do we work together to mitigate the risk that we face. So the holistic set of actions that we've worked with the Ministry of Education to implement, we started this last year when they reopened schools the first time, worked with them to develop a set of guidelines. We're now working with them, supporting them to review these guidelines, work with the schools, the states across the country to enable a safe reopening of schools. At the same time, always watching the situation. The risk in schools is not the same in Lagos versus Maiduguri. They're not the same in township areas versus in rural areas. So there are many levels that have to be considered, and it's why WHO always encourages us to have a risk-based approach to the reopening of schools. So that's what we have started. None of these decisions are fixed in stone. The Federal Ministry of Education with all the state ministries will continue looking through this, advise the PTF on what to do, and collectively we will always try to make the best decisions in the best interest of most Nigerians. So to protect our children and students, families, teachers, school staff, and everyone in the community must work together. School administrators have a critical role to play in ensuring that classes are well ventilated. Children are reminded to wash their hands. There's hand washing facilities available. And critically, that there's sustained communication between parents and teachers in order to take collective responsibility for the work that we're doing. In boarding schools, please ensure that you have a clear mechanism to ensure that when children do have symptoms, there's a place identified to put them in and identify, have a number to call. You understand the health facilities around you, your public health department, understand what needs to be done when you actually have a case that might be COVID, so you can activate testing. So I want to really assure all Nigerians across the country that we will continue working together, all of us on the PTF, with the Federal Ministry of Education in leadership on this issue, and make sure that we try to continue making the best decisions for our children. In conclusion, we must recognize that we continue to face other outbreaks. We've just deployed a team to Benue State to respond to a cholera outbreak. This is the period of the year where Lassa cases begin to increase, so we mustn't drop our eyes from other balls and make sure that we continue to do the work that we're doing across every state in Nigeria to keep the country safe. These guidelines and all the other guidelines that we produce are available on the NCDC website, covid19.ncdc.gov.ng. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, Director Generals, members of the press, good evening. My name is Mukhtar Mohammed. I'm the National Incident Manager for the PTF, and I here stand forth for the National Coordinator. One of the decisions that the PTF took about a month ago, last year, was to increase testing in the country. The chairman had mentioned that we are going to have a testing drive whereby all the states will be engaged to increase the number of testing that they are doing. I'm glad to inform you now that the PTF has agreed that testing drive will commence in all states, and all local governments are expected to participate. We expect every local government to test samples of between 400 to 500 samples in the next 2 to 3 weeks. We are working with the state government, both the state governors and the Honorable Commissioners of Health, to ensure that funding and logistics arrangement are put in place to ensure that we are able to optimize testing everywhere in the country. This has become critical due to the rising number of cases. And we know that without testing, we will not be able to define our epidemic properly. If we don't test, we may not be able to detect those that are positive, we may not be able to identify those that would require isolation and get treatment. The small fires that are started with little infections will progress into large fires and eventually become inferno and consume many more people. It is therefore in this direction that we have come out with this protocol and implementation strategy that advise all the states to commence this activity as soon as possible. As I said earlier, we are working with the states, and states that are ready will have this activity commenced. We have urged the states to support the implementation of technical staff that will be visiting them from the NCDC and the Federal Ministry of Health anytime from next week to ensure that this activity goes unhindered. Regarding the airport travel protocol, we have noticed also a great improvement in the level of compliance by international travelers arriving in Nigeria. You will recall that the PTF was forced to sanction defaulters of the established travel protocol by placing them on a 6-month travel restriction. As a standard practice, that public notices are issued by arms of government on important issues, the PTF, after consultation with relevant agencies, published the names of the first 100 defaulters and subsequently reached out to a large number of those affected with the view to resolve their complaints. These public notices in print and digital media are in alignment with the Media Code and ethics for reaching the public with information, and in this case, improving compliance with the travel protocol. The overall aim is not to punish, but to get travelers to comply with the protocol that we have already put in place. And we have started noticing a great improvement in compliance and testing following the sanction that has been published. We will be publishing the list of another 100 persons who have defaulted. This time, these are people who have failed to book their second test in the laboratories. This will be communicated to you as soon as it is done. We therefore urge everyone to continue to adhere to restrictions and to the protocol put in place in order to slow down the spread of infection. In a related development also, we have commenced intensifying activities in the maritime sector with a view to have better control and containment in that area. A special task team on COVID-19 for the Niger Delta and maritime sector was inaugurated, and we have the protocol developed for implementation in both the formal and informal waterways. It includes all the states in the Niger Delta and the riverine areas. The membership includes rivers, Delta, Edo, Cross Rivers, Imo, Akwa Ibom, Ondo, and Bayelsa. We have government agencies to support them, NIMASA, NNPC, Shippers Council, and we also have representation from the Nigerian Navy and Operation Delta Safe. The committee will be led by distinguished Senator Enang Eta, Special Assistant to the President on the Niger Delta. With the implementation of this protocol, we intend to implement more testing along the waterway corridors with a view to identifying people who are coming without PCR test, and also to offer them the opportunity to test and also have isolation. Thank you very much.
Distinguished ladies and gentlemen, good evening. The federal government is determined through the Presidential Task Force to stop the spread of the virus in Nigeria by accessing WHO-approved vaccines, which will be administered free of charge at government-designated and some private health facilities. We have developed a comprehensive national COVID-19 vaccine deployment and vaccination plan. We have also developed an operational manual to roll out the vaccine when they become available. While we continue to observe the preventive measures of wearing face masks, washing hands regularly, sanitizing and observing physical distance, we encourage all Nigerians to get vaccinated when vaccines become accessible, as the benefits of the vaccines far outweigh the potential side effects. The chances of spreading the disease is significantly reduced once community members are vaccinated and protected, owing to the fact that the vaccine triggers an immune response that will protect your body against the virus if encountered. Please note that taking the vaccine will not only protect you, it will also protect your loved ones and community members against the COVID-19 disease as we work towards developing herd immunity. There currently seems to be growing vaccine hesitancy, and this is largely caused by misinformation, leading to mistrust, doubt, suspicions, and conspiracy theories. We urge the public to disregard such misrepresentation from unverified sources and listen to the medical experts for confirmed information. It is important to note that vaccines, including COVID-19 vaccines, are manufactured under strict compliance with WHO guidelines. Therefore, COVID-19 vaccines do not contain any harmful substance or microchip and does not alter human genetic information. Furthermore, any vaccine coming to Nigeria will be tested by NAFDAC and certified safe for human use before it is administered. We would like to assure all Nigerians that this verification exercise will also be applicable to the COVID-19 vaccine, and NAFDAC will continue to monitor the efficacy of the vaccine even after its administration to ensure proper documentation of any side effects. I want to reiterate that the first set of vaccines expected in the country is the Pfizer-BioNTech mRNA vaccines, and equipment that are required to store them, that is the ultra-cold chain equipment for storage of the vaccines, are available at the National Strategic Cold Store of the National Primary Healthcare Development Agency. I will invite members of the press corps to go and take a look at the National Strategic Cold Store along Airport Road. Those ultra-cold chain equipment are available. We have over 2,100 liters capacity. The requirement for the 100,000 doses of Pfizer vaccine that will be coming by the end of January, early February, is 500 liters. So we have more than enough capacity for the 100,000 doses. I make particular reference to those reports that claim that we are going to waste the 100,000 doses because we do not have any ultra-cold chain equipment. Pfizer has also informed us that the Pfizer COVID-19 vaccines can be stored for 5 days at +2 to 8 degrees outside of the ultra-cold chain. which is suitable, especially at lower level. This means that the ultra-cold chain storage is only required at the national level and 6 zonal stores where the vaccines can be stored for longer periods. The vaccines will then be transported to the lower levels using dry ice in insulated thermal containers when they are ready to be deployed. I want to emphasize that the Presidential Task Force, the Federal Ministry of Health, does not intend to invest too heavily in the ultra-cold chain equipment because of the logistical challenges. We already have thousands of refrigerators and freezers that we use for our routine immunization vaccines. These are available all over Nigerians. So we will be looking to prioritize those vaccines that can be stored between +2 and +8 degrees Celsius. It just makes sense. There are ongoing collaborations with the Presidential Task Force on COVID-19, the Federal Ministry of Health, NAFDAC, and the National Assembly to ensure the availability of the vaccines. Therefore, sensitization meetings are being organized with various groups within the country. This is in order to show up confidence on the steps being taken by government to ensure that safe and efficacious vaccines are made available to all Nigerians. In the last couple of days, we have heightened our engagement with several key stakeholders to provide the correct information about vaccines. We acknowledge that it is within the rights of all Nigerians to ask tough questions about vaccines or anything that is related to any drugs that they want to take. It is also our responsibility to make sure that we provide the right information. This is why, as a presidential task force, we have also stepped up our communication with stakeholders, with the generality of Nigerians, not to castigate people for asking questions, but putting the right information out there. In the last few days, we have engaged with state-level health educators and community mobilizers, medical and health workers associations and unions to help us carry out the task of informing and educating Nigerians, because we can't do it all by ourselves. We've had engagement with media gatekeepers such as yourself, religious leaders, civil society organizations, to name a few. These engagements will continue with the Muslim and Christian religious leaders. I want to use this opportunity as I wrap up my speech today to really appreciate the media for all of the outstanding work that you've done since our engagement, trying to put the correct information out there so that we can really scale the barriers to accepting vaccines. I want to also recognize and appreciate the efforts of our development partners, particularly the World Health Organization and UNICEF, for assisting us to develop our vaccine safety protocols. I want to acknowledge and also appreciate our sister agency, the NCDC, the National Orientation Agency, for all of the collaborations that have really helped step up our ability to reach Nigerians. Lastly, I would like to encourage you to visit our social media platform for updated and confirmed information about COVID-19 vaccines. Thank you very much for listening. God bless you.
Thank you very much, the Executive Director, National Primary Healthcare Development Agency. To clarify your name with Pfizer, Pfizer and Pfizer, that they are so close together. Thank you very much, sir. It was so nice to have you with us today. The time has arrived for us to take your questions. And with us is our lady, Amaka from Arise.
The chairman, members of the PTF, my colleagues. My name is Amaka Ude. I work for Right News, and of course I report for them. My first question actually goes to the DG of the NCDC. My concern stems from what you have actually told us here, and even the chairman did talk about the fact that we need to scale up testing in the country if we need to contain this virus. The turnaround time for testing, what is it? I know the last time you told us that once a sample is collected, it takes 24 hours and the result is out. Typical example, I had a test done about 3 weeks ago while I was doing a report on testing. I can tell you that my result is still not out till now. And this is the story of a lot of Nigerians. And imagine if I'm positive, that means 3 weeks after, I would have spread the virus if I'm not being careful. So let's clarify that. Our turnaround time for testing in Nigeria. My next question actually goes to the Minister of Health alongside the Dr. Faisal Shuaibu. It has to do with the vaccines. Yes, we've talked about the COVAX facility, which will help us get about 20%. And of course, you had spoken about 50% more coming into the country sometime much later to vaccinate the population to get herd immunity. How do we intend to finance the vaccines, budgetary allocations, because Nigerians are asking these questions. These are not my questions, but these are questions from Nigerians. And also, my next question goes to the chairman of the PTF. We keep talking about the fact that people are not adhering to the protocols, especially as it has to do with the wearing of the face mask. But the reality on ground is that we are in a recession. Food inflation just released by the NBS, 19.5%. That's a lot. I did a story over the weekend where I asked people, why are you not wearing a face mask? I can tell you, especially in the rural areas, most of them cannot afford it. People are thinking about food before they're thinking about face mask. So is there a way, I don't know, where, from your office or the federal government can make a way where, at least even if it's a cloth mask, is supplied in the rural areas in particular? And also staying with you, Lagos State, some time ago, especially in the urban areas, they introduced fines for non-adherence to wearing of face mask. Are we going to consider replicating that nationwide? Because these numbers, they're getting scarier by the minute. And my final question goes to the representative of the national coordinator. You had spoken about releasing the names and the passport numbers of those who have not gone for their test after 7 days. Are we considering going back to what we had earlier on, where we would actually hold on to people's passports until they get their second test done before they're allowed to have their passport? But because announcing these passport numbers, at the end of the day, how far-reaching is it? Those are my questions. Thank you very much.
The Chairman, sir, members of the task force, my colleagues, good evening. My name is Nancy Oyedia Oram from AIT. I would like to start with the Minister of Education. I think on Monday you mentioned that there was due consultation with major stakeholders in the education sector. But I want to find out what informed that decision of sticking with the January 18 date for school resumption? Because I know the PTF have mentioned severally that decisions will be based on science and data. Looking at our figures, when we had less than 500 cases in a day, we went on a lockdown. But we're counting in thousands in a particular day, and still we have the students going back to school. Take, for instance, in the UK. UK is vaccinating like 100 persons in 1 day. Still, they're on a major lockdown. So I want to know what informed that decision. Was it based on data? And secondly, there have been concerns by the Nigerian Medical Association that have said that, well, this is not the right time for students to resume at school. We have ASUD have also said that tertiary institutions do not have infrastructures put in place for the resumption of this student. We've seen the National Assembly come up to say that let's postpone for 3 months. So I want you to respond to some of these challenges. And before the PTF briefing, we had a press statement from your ministry saying that students are not mandated to come up with a test result before resuming, which was not the case last year when the exit classes were mandated to come for their exams. They were mandated to present a test result, which is not so. So I want to know why that is so. And finally, to the DG of Primary Health Care, well, we saw the NAFDAC DG, I think, over the weekend, come out to say that there may be fake vaccines that may be coming into the country. For some of us that have not seen these vaccines, how do you differentiate between a fake vaccine and original vaccine? Thank you.
Ministers and my colleague, my name is Abiodun Molara Popola, plus I'm going to ask my question in Yoruba. And we really appreciate the Honorable Minister of Health State to please kindly answer this question so that at least we can be able to, for the grassroots also to understand what we are really saying here. Ìbéèrè mi sà ni wípé à ń sọ̀rọ̀ nípa abẹ́rẹ́ àjẹsára èyí tí à ń gbèrò wípé títí di àkókò kan ó máa wá sí orílẹ̀-èdè Nàìjíríà. Mo fẹ́ kẹ́ bá wa sọ ní kúkúrú nítorí àkókò wa. Àkókò tí abẹ́rẹ́ àjẹsára yìí máa wá, kí ni orúkọ abẹ́rẹ́ àjẹsára yẹn àti wípé ní báyìí à ń gbọ́ wípé àwọn ayédèrú abẹ́rẹ́ àjẹsára ó ti wà níta. Ẹ sọ díẹ̀ nípa ẹ̀ fún wa. Thank you very much, sir.
Good evening, all. Rachel Abuja. My first question is for the chairman. Sir, at the beginning of the pandemic in Nigeria, we have corporations like NMPC coming forward to say they are going to build infectious disease hospitals in our 6 political zones. We would like to know how far they've gone with this project, because we are aware of the one in Maiduguri recently inaugurated or built. Now, my next question is for the Minister of Environment. Sir, I would like to know what your men, that's the environmental officers, are doing in Kogi State. We want to know their findings. Yes, because we would like to know their findings so that we can get things well with the state and your people. Don't worry. My next question is for the WHO rep. Some African countries are beginning to back out from the vaccine, from getting the vaccine. How will this affect the continent as a whole? Thank you very much.
Mr. Chairman, members of the task force, my colleagues, my name is Mohammed Saliu Nazif. I report for Voice of Nigeria. My question goes to Dr. Shuaibu. You talked about vaccine hesitancy across the country, which you said due to misinformations and conspiracy theories of some sort. At the moment, sir, what is the level of engagement have you had, your agency, with the grassroots? Secondly, you talked about vaccines arrival into the country sometimes around March, and the issue of vaccine verification. What is the timeline do you have between the arrival of the vaccines, the verification exercise, and the vaccination exercise proper? Thank you.
The chairman and members of the PTF and my colleagues, my name is Kenneth Nanim. I report for NTA. My question will be for the chairman of PTF. Before now, before the announcement of these vaccines that are being expected, the indigenous scientists here have been making efforts, to come up with a vaccine, and when the Minister of Health was also briefing, he made mention of that. So Nigerians will want to know, why did the issue go silent, issue of developing indigenous vaccines? Why did it go silent? Because you made mention that about 10 million naira has been earmarked to explore opportunities in that area. Now, why is it that that tempo is now going down, and we are now talking of more of bringing in vaccine from outside? Another question would be if any application has been made to NAFDAC as to validate the vaccines we are expecting, because NAFDAC said last week that they have not received any application for validation. Thank you.
Thank you very much, Kenneth, for the last question. We want to thank all our colleagues at home who also sent in some of those questions. Let's take the one that is, people are more concerned. The Honorable Minister of Education, Madam Adamu Adamu, may wish to take up.
Let me start by reminding you of what I said here last briefing, and which was misunderstood, and it is tied to what I was asked today. What happened was, the Minister of Education was directed by the PTF to go and look at the date again in view of figures that are rising. And Minister of Education did exactly that. We went, sat down, looked at the figures, reviewed the reasons that informed the choice of January 18th. And we came to the unanimous decision that schools should not open. Unfortunately, I have to tell you the details because it is supposed to be a collective decision. But you must understand the schools we are talking about, federal government has only about 100 out of thousands of schools. The schools are under the jurisdiction of states. And just like the Minister of Education was unanimous in saying that schools should not open, states were unanimous in saying that they should open. So this was a compromise position with PTF, as the chairman has just said, telling you that we'll monitor what is happening. Figures certainly they are rising, and they don't show to the opening of schools. But probably it is something that we can take. But PTF will be looking at it on a daily basis. This is something that may be reviewed again. She also asked why we didn't ask that students will have to have verified test results. We didn't do that because it was simply impossible, looking at the numbers. When we made that request, I think it was exit classes who are sitting for the examination. Now we decided we are just going to take the temperature as students resume. That is an indication of who we should test, because I think we should start something that we can do. Thank you very much.
Thank you, sir. Let us
in our ministry. Well, let me start by saying, first of all, we found that coronavirus is zoonotic, meaning it can go from animals to humans. That's one. Two, we found that from the beginning, a lot of people do not quite believe that even coronavirus really exists. And unfortunately, up to today, there are a lot of people and some highly placed that you will not expect them to say, oh, there is no coronavirus. After all this number of people that died, over 1,000 and over 100,000 that became infected, and people can see people on ventilators struggling to breathe, yet they don't believe. We found that out through our interaction with people at the grassroots. Like I've mentioned earlier, the Federal Ministry has environmental desks in all the 36 local government, and also in the Ministry of Environment, we have all of that. So we have found out that people really do need to be educated, need to be told the reality that this virus do exist, and people are getting infected and dying. We also found out that in a situation like this, it is some people that will tell others, hey, it doesn't exist, and people will believe. So there's a lot of psychological also implication as to relaying. So that's why we focus so much on advocacy to let the people know that the virus do exist and it kills, whether you have somebody you know or somebody you don't know that dies. But I'm sure by now, almost every Nigerian by now would have had contact with someone who knows someone that has either lost a loved one to coronavirus or that has been infected and perhaps cured. So these are some of the things that we really found out about the current pandemic and about coronavirus, basically. Thank you.
Thank you very much, Honorable Minister of Environment.
That relate to the health sector, I'll just go out right away. I'll start with the one about the vaccines. Yes, it is true that there are indigenous attempts at making a vaccine. We do have some areas where there is what we call a successful candidate vaccine that has been made in this country. And the government, the PTS, is going to be looking at the possibility of developing this further. But you must realize that to make a vaccine requires, first of all, a lot of technology a lot of resources. And what you need to be able to do is to test your vaccine. So making the vaccine is just the first part. And you need to do a testing, very intricate testing that usually is generally in 3 phases, phase 1, phase 2, phase 3. That costs a lot of money. That takes a lot of time. So it is, and then a lot of resources. So I have had conversations with the entity that did develop a promising vaccine, but which needs to be heavily financed with resources which need to be calculated and brought forward. I've asked that they should be sent to me for further, sending it further into the system for consideration. With the question of fake vaccines, well, I think quite clearly we have said that only the NPHCDA is authorized at the moment to give the vaccines, and they will identify themselves. If you take from any other source, it's likely to be a fake vaccine. So unless the National Primary Healthcare Development Agency is giving you the vaccine, do not take it. I also said that there are sources of private donations, those who want to actually source real vaccines, but even those ones will be handed over to NPHCDA to administer, so that you have records and you also have data, all of it uniformly gathered and not haphazardly done. Now, there are many different kinds of vaccines. There are vaccines that cost as much as $20 a dose. There are vaccines that cost as much as $3 or $4 a dose. So the quantities we require and the amount we spend will depend on the ones we are going for. The NPHCDA has already provided a certain budget which has been approved, but it is just a base on which we are going to work, because the actual cost will depend on the final access. As you know, the WHO, as if I understand correctly, has actually only licensed, not licensed, but giving recognition to one, hopefully 2 other vaccines coming up soon. And we from COVAX are getting access to one type of vaccine, and hopeful of getting access to another type of vaccine from the African Union. So the supplementary budget that will be needed, or the amount already available, is a base money out of which we might be able to make savings, or in fact give a supplementary, look for supplementary budget. I think that's it. The financing of vaccines, our own vaccines, and the hope of being able to have an indigenously produced vaccine. Meanwhile, the budget of 10 billion is there to support the domestic production, not the research. So we cannot apply that actually to the research yet, so there has to be a different funding. Now, the domestic production, what is that? It is possible that Nigeria will get a license to produce a vaccine that's already there and approved internationally. That's already happening, because even Pfizer, producing in the United States, is licensed a company in another country to produce it, and AstraZeneca has licensed a company in India to produce. So we can get the possibility of license production, and so that 10 billion is seed money which we have earmarked for domestic production through a company that is able to actually support that initiative.
Thank you very much for the good news.
Media representatives, ladies and gentlemen. Well, the ìbéèrè tí arábìnrin Abiodun Popoola láti Voice of Nigeria tó béèrè ní pé abẹ́rẹ́ àjẹsára tí à ń sọ̀rọ̀ nípa èyí báwo gan ni ó ṣe jẹ́, tí àwọn ènìyàn wa tí wọ́n wà nílé tí wọ́n ń gbọ́ wa tí wọ́n dẹ̀ ń wò wá, gbogbo wa la mọ̀ yí pé abẹ́rẹ́ àjẹsára wà fún àwọn àìsàn kan pàápàá tí ó jẹ́ pé àwọn ọmọdé ló máa ń ṣe jù, àbí àrùn tí à ń pè ní polio tí ó ń fa kí ẹsẹ̀ kó rọ, àbí ti àrùn ikọ́ jẹ̀dọ̀jẹ̀dọ̀ tí à ń pè ní tuberculosis, tàbí máa ń fún wọn ní BCG, àbí tó ń fa àrùn tí à ń pè ní measles tó wà. Ṣùgbọ́n èyí tí à ń sọ̀rọ̀ nípa ẹ̀ báyìí ní àjàkálẹ̀ àrùn tó wà káàkiri ayé tí à ń pè ní COVID-19. Nígbàtá ti rí pé kò tíì sí ògùn kan pàtó tí a lè sọ wípé ó ń ṣiṣẹ́ fún àjàkálẹ̀ àrùn yìí tí à ń pè ní COVID-19. Ìyẹn ni gbogbo àwọn tí ó ń ṣe iṣẹ́ ìwádìí tí à ń pè ní research àti láti lè mú kí àjẹsára yẹn kó wáyé. Àjẹsára tó dẹ̀ wáyé yẹn báyìí níwọ̀n lóríṣiríṣi tó ti wà ńlẹ̀ báyìí. Ṣùgbọ́n bó ṣe wà ńlẹ̀ yẹn, nítorí pé bí ó ṣe wáyé ó jẹ́ ní kíákíá, ìyẹn ni ó ṣe jẹ́ pé orílẹ̀-èdè kọ̀ọ̀kan tí wọ́n bá ti máa lò, wọ́n máa ń fún wọn, ìjọba wọn máa fún wọn ní àyè fún nǹkan tí à ń pè ní emergency use authorization, torí pé ọ̀nà tí abẹ́rẹ́ àjẹsára yẹn ṣe wá kò ṣe bí a ṣe máa ń ṣe ní ó máa ń pẹ́, ọ̀tẹ́lẹ̀ ó wá ní kíákíá. Èyí táwa dẹ̀ ń fojú sí tí à ń wò lọ́wọ́ ní wípé èyí tí a bá ní ètò láti fi gbà wọlé sí orílẹ̀-èdè wa, nítorí pé tí a bá gbà wọlé ó níbi tá láti kó sí ní nǹkan tá à ń pè ní temperature tí ó jẹ́ tó fi ní jẹ́ kí abẹ́rẹ́ àjẹsára yẹn kí ó bàjẹ́. So a ṣì ń wo èyí tó máa dá fún àwọn èèyàn wa àti fún ìlú wa àti fún irú bí ìlú wa ṣe rí. So à ń ṣiṣẹ́ lórí yẹn báyìí. Ṣùgbọ́n a wá ń ṣe ìkìlọ̀ fáwọn èèyàn wa wípé abẹ́rẹ́ àjẹsára eléyìí tá à ń sọ̀rọ̀ yìí kò ń ṣe èyí tí wọ́n lè lọ máa táwọn èèyàn kan lè lọ máa tà ní ọjà, gẹ́gẹ́ bí arábìnrin Abíọ́dún ṣe sọ, ayédèrú yẹn fake nìyẹn, fake vaccine. À ń fún àwọn èèyàn wa ní ìkìlọ̀ wípé abẹ́rẹ́ àjẹsára tó bá ti wá láti ilé-iṣẹ́ NPHCDA tí ó jẹ́ pé àwọn ni ó ń ṣe alábòójútó fún abẹ́rẹ́ àjẹsára, a gbọ́dọ̀ lọ gbàrú ẹ̀ o kó má bàa di nǹkan míì sí wa lára. A dẹ̀ ń rọ àwọn èèyàn wa pé ká jẹ́ kó mọ̀ pé abẹ́rẹ́ àjẹsára tó bá máa wọ̀lú gan, ó ní láti jẹ́ pé NAFDAC wọ́n mọ̀ ń pa ẹ̀, tí wọ́n dẹ̀ ti sọ fún wa wípé èyí tí a fẹ́ nìyẹn, tó dẹ̀ máa láti lọ sí ọ̀dọ̀ NPHCDA. Tó dẹ̀ àwò wípé ní àsìkò tá a wà yìí, abẹ́rẹ́ àjẹsára yẹn ni ó ṣe pàtàkì jù fún gbogbo àwọn èèyàn wa láti lò nígbà tó bá ti dé sí ìlú wa. Ṣùgbọ́n gbogbo ètò yẹn náà ni PTF, ìgbìmọ̀ tí ààrẹ orílẹ̀-èdè gbé kalẹ̀ láti ṣètò àti rà àti gbà wọlé àti máa fún àwọn èèyàn wa ní bó bá ṣe tọ́ àti bó bá ṣe yẹ. Ìdí yẹn la wà báyìí. Ọlọ́run á gbà fún wa. Mo rò pé mo ti gbìyànjú. Thank you very much.
Thank you very much, Honourable Minister of State. I was just discussing with my friend.
Thank you very much, My brother, in fact, the answer to the question I was going to offer Amaka is to please call 6232 for any problem. But honestly, our role at LCDC is to really support the states. But to be honest, FCT has been trying very hard. If it was a positive result, it would have been called. So it's probably a negative. They send out text messages. Some of your phone providers have ways of locking up so you don't receive text messages from unknown numbers. So most people would receive a text message if it's a negative result directly to your phone. But if you've set up your phone in a way that you can't receive text messages from unknown numbers, you will not get that text. So we'll look into it. Please call 6232 seriously if there's any problem. But I really know our colleagues at the state level are working very hard. At NRL, really, the tests are done in 24 hours, and all the results are sent to the states for dissemination. So there might have been a challenge here and there. But this is really to, across the country, you can imagine in Lagos, right now, we're confirming 600 to 700 positive cases per day in Lagos. Each of those cases will require follow-up. So really, our colleagues at the state level are working very hard to make sure that people get results, people get into care, are managed at home where necessary, in the facility where necessary. So if there are any glitches, we apologize, but you will agree with me that the situation has improved a lot since last year. Our call centers, previously we used to have a lot of complaints through calls, emails, social media. A lot of that has reduced. So if there's one particular incident in your case, we'll look into it and find out why it happened and keep working to improve the system. Thank you.
6232 is the number. Let us now call the Executive Director, National Primary Healthcare Development Agency.
Thank you, Director. My name is Faisal, not Pfizer. So I have no shares in the Pfizer company. So the Honorable Minister of Health has really tackled most of the questions. I think the ones outstanding are the ones from the Voice of Nigeria around the level of engagement with the grassroots. I think that's a very brilliant question. One thing that we've taken note of with the COVID-19 vaccine rollout is that we will not make the same mistakes that we made during the polio eradication fight when we did not engage the grassroots in good time. This time around, we're starting from the grassroots, making sure that we engage with traditional leaders, the local leaders, religious leaders. These are the gatekeepers of our communities. This is why, as part of the engagements we've had in the last couple of days, we engaged the Christian religious leaders to really hear what are some of the concerns that they're hearing from their congregation. But we're also engaging with the community-based civil society, like we had an engagement today with civil society organizations, community-based organizations. I mentioned the outstanding role that the Voice, the National Orientation Agency is playing in terms of our collaboration with them. The National Orientation Agency, as you're aware, has at least one community mobilizer per local government area, at least one. And these people are working together with our staff at the state and local government level, working with the community-based health workers to engage at community level. We've not reached the level of engagement that will be, we will say we're there yet, but it's a progressive effort to engage with community gatekeepers, and we're really excited about the work that primary healthcare workers are doing. They live with community members, and they are using their vantage positions as trusted members of the health workforce to communicate about the safety of the vaccine to community members. And in terms of grassroots reach, the media is very, very critical. You guys are also, reaching out to community members. A lot of people in our communities listen to the radio, and that is really a veritable source of getting the message to the communities. He also asked the question about the timeline between the arrival of vaccines and the certification process. So the certification, the process of trying to certify the vaccines safe and effective for use has already started even before the vaccines get here. What do I mean by that? What I mean is that NAFDAC is already engaging with Pfizer. Now, the level of that engagement is still preliminary in terms of some of the requirements that has to be satisfied by Nigeria before the dossier, that is all of the documents that describes the work and the nature of the vaccine. The dossier will be presented to Nigeria as soon as Nigeria fulfills some of the requirements. And I know that the NAFDAC DG is in talks with Pfizer, even as we speak, in terms of meeting those requirements before the dossier is sent to NAFDAC. Immediately it is sent to NAFDAC, NAFDAC will start the process of reviewing those documents, including results of the clinical trial. That is all of the studies that have been done in human beings. And this makes it easier for them to finalize and finish the process of certification when the vaccines arrive. Again, the DG of NAFDAC has mentioned in the past that they will use the process of reliance. Reliance because very stringent regulatory agencies such as the Food and Drug Administration of the US and similar organizations, SRAs in Canada, in Europe, have already certified these vaccines as safe, but NAFDAC will also do its own due diligence looking at the contexts of Nigeria to certify these vaccines as safe. So we feel that pretty much, from what I've heard from the DG NAFDAC, it probably will not take more than a week or two to finish that process. But I'm sure that this is something that she can provide you more details about. Thank you very much.
We now invite the...
For the question, I believe your question is about holding the list of defaulters, the list of 100 defaulters that have been released. Why wouldn't we hold on to their passports? So if you recall early on, we were actually holding passports. But after due discussion with the Nigeria Immigration Service and also the NIMC, Identity Management, we were advised that the best way to do this is, number one, not to publish names. So that's why we didn't publish names of the people. We only have the passport numbers. And number two, actually, they can disable the passports for 6 months. You cannot travel without that travel document. So they don't have to have a space and have issues of passports getting lost in the airport and people coming to pay to get their passports through the back door. So all that is resolved now with this. We can disable the passports. However, we have provided a window for people who have genuine complaints to either send it through our email or contact the PTF, and we will call them. And we've been calling a lot of them to find out the issues, and a lot of them have actually been resolved. Thank you.
My question was actually the easiest one. It was about the countries, African countries backing out of the vaccines and the impact that it will have on a pandemic. Well, as we said it since the beginning, to control this pandemic, we need a combination of tools, starting with detection of cases, contact tracing, isolation of cases, treatment, monitoring contact, quarantine, observing non-pharmaceutical intervention, treatment, and vaccines. And as we said it before, until the world gets an effective vaccine and it's distributed equitably to all those who need the vaccine, we will not be able to control this pandemic. Today, the 148 sessions
of the Executive Board of the World Health Assembly opened. And this discussion about equitable access to vaccine was raised. But in the morning, it was more about the vaccine nationalism, where self-paying countries have secured most of the vaccines available, most of the doses available. The question that was asked this evening was at the other side of the coin, where we have some countries refusing already the vaccine. What I would like to say, to recall, is that if we don't have access to the vaccine in a more equitable way, globally, it will not be possible to control this pandemic. And everybody has a role to play. Self-paying countries, wealthy nations, and African countries, including those who are refusing vaccine. So WHO will continue to communicate, to use the leverage to convince all the nations to share equitably the vaccine so that we could bring this pandemic once and for all to its end. Thank you.
Thank you very much.
Amaka, you did ask about face mask or any facial clothing. I do not want to sound insensitive to the plight of the people of this country. I know we are going through very, very hard times. But I think we can provide for a little form of protection for ourselves. The truth about it is that the use of the medical face mask is one thing that we have tried as much as possible even to discourage, so that this medical face mask that we are using can be available to the frontline workers, those that work in medical facilities. We have consistently encouraged the use of facial clothing. And I think in any part of Nigeria, in any home, we can provide for that. Yesterday, I was watching on the CNN some clips that came out of India in a particular community where they were so excited and they were rejoicing for the rollout of vaccines in India, which was done yesterday. And I noticed a group of people that were around where that merriment was taking place, because they had a bonfire where they were burning symbol of, or effigy of COVID-19. Most of the men that I saw sitting down there, you would think it was their wife's wrapper that they cut off and tied around their faces, because it was multicolored, meaning that you can always find something to protect yourself with. If your perception of risk is that I need to do something to ensure that I do not get infected. Like I said, it's not that I want to sound not concerned about the plight of Nigerians, but I believe strongly that if our perception of risk is that each and every one of us has the responsibility to protect himself or herself, we will do everything to get a face covering that will protect us. That is even the best, because what you will do is that when you return home in the evening after the day's work, you wash it, iron it. It's stronger, it's durable, and you can even personalize it. So I think, yes, as much as possible, I would encourage those that have the capacity to provide masks in their settings, in their communities. But the emphasis should even be the cloth, facial masking, so that the people can reuse it. I know the temptation, a lot of people do reuse this one. But this is supposed to be on a daily basis. After a day's work, once you fling it or you dispose of it in a reasonable manner. Even the disposal of this requires a reasonable manner, so that you don't endanger people who go into, scavengers that go into dustbins to begin to put their hands and pick these things. And oftentimes it's the quantity they find that encourages them to recycle it. So the cloth facial masking is even the most advisable thing for us to do. And I believe strongly, without being insensitive to the hardships that people are going through, if our perception of risk is very, very important to us, we will be able to provide for a facial clothing. Rachel, you did ask about the construction of 6 infectious disease hospitals in the 6 geopolitical zones. That was a program that was initiated by the NMPC and its partners in the oil and gas industry. And I think they were located in different parts of the country. Maiduguri was one, I think Katsina was the other, and Port Harcourt, and I think somewhere around Imo. I am not very sure about the status of the remaining ones that have not been commissioned. But I believe that NNPC and its partners are institutions of honor. If they gave their undertaking that they were going to establish those infectious hospitals in the different parts of the country, they are going to do it. And you remember on the outset of our national response, we did make it very, very clear that we do not control what they were doing. We did not determine the locations of those institutions. We only asked for information so that we can align it with our national response and have that data. But I assure you at the next briefing, I will be able to talk to the Group Managing Director of NNPC to get an update of the level of completion of those establishments. It's very, very important. And I must say this with every degree of confidence, that never in the history of Nigeria have we ever mobilized the corporate world to key into a national response as we did with COVID-19 national response. Never. Never. Where you had the entire business community coming in, establishing a major flank of our national response. Today in Abuja, we would have been in big trouble with oxygen, except for the intervention of COVID, where today we get an average of 150 cylinders on a daily basis that are distributed among the health facilities here in Abuja. And they have responded in different ways. They have set up PCR laboratories in different parts of the country. They have opened mega isolation centers that were closed down, but are being reopened now by the state governments who were given trust of this equipment. So I will continue to commend the effort of the corporate world and NNPC and its oil and gas partners for responding in the manner in which they have responded to our national response. The travel portal would not have been possible except for COVID. That's one of their major interventions. In addition to the palliatives that they distributed all over the country, billions and billions of naira were committed to that. So I think truly, if we can maintain this, the partnership between the government and the corporate world in major aspects or spheres of our national developmental efforts, so much will be gained in the process. The third question, Rachel, okay, I've answered your question. The third question is, NTA, you were talking about the issues of vaccines, that at the onset of this response, we spoke about local research and production of vaccines. Well, it's a long way. I believe we have created the enabling atmosphere for our researchers and our scientists to explore their intellect and knowledge and try to get for us a local solution. You remember when we started, I was harassed on getting the Madagascar solution. We finally got it and we realized that it was just a herbal drink. It's a process, and it's a very, very highly technical process. It's not a thing that comes easily. If you know the amount of money that has been committed by the Western world in the advancement of the vaccines that we've gotten on the horizon thus far, it's a lot of money. Billions and billions of dollars have been committed. But in our own small, modest way, we've created the enabling environment for our researchers and our scientists. You remember, Amaka, I will remind you, when I inaugurated the committee set up by the central bank, committee of experts, people who are knowledgeable in this field. The DG of NAFDAC is there. I think Professor Salako, Tomori, and all of them members of that committee. And their responsibility is to evaluate any finding by a researcher or a scientist that will help us in managing COVID-19 and eventually finding appropriate either cure or vaccines. So I believe that those that are knowledgeable in those fields must have approached that committee, because I think about 23 or so billion naira was set aside by the Central Bank of Nigeria for the purposes of investment in research, findings, and inventions. I'm yet to hear anything about that. So I will continue to urge our researchers and our inventors to take advantage of the resources that have been provided so that at least we can also work towards developing a local solution. But I must add a caveat here. COVID-19 vaccines is not a walk in the park. It requires a lot of work. I am not in any way doubtful of the competencies of Nigerians, but I'm concerned about the infrastructure that we have. You will say, well, but India is manufacturing vaccines. You might wish to know, India is considered the factory of vaccines manufacture. If Dr. Sani was around, he would tell you that it was India's intervention in HIV/AIDS manufacture of their drugs that brought down the price of HIV/AIDS solutions. Once India came in, because they have such a large capacity, they have rolled out a program of vaccinating 300 million in the next, I think, 1 or 2 months. 300 million will be about what percentage of their population? Because they are about 1.3 billion. So they are vaccinating, they have rolled out. Yesterday started, as a matter of fact, the first person that took the dose was a sweeper in a hospital. He was the first to be vaccinated in a nation of 1.3 billion people. So India has a large capacity and ability and infrastructure. And you see, one of the things that we have been trying to do with our national response is to ensure that after COVID-19, one of the legacies that I believe I and other members of and all the members of the Presidential Task Force want to leave behind is to have improved on the infrastructure, our health infrastructure, realizing that we started with 2-3 molecular PCR laboratories. We are talking about 112 existing in the nation today. That's not a small feat. In a period of just about 10 months, we have achieved that. We are talking about setting up at least in each state of the Federation a 10-bedded ICU with all the infrastructure. We are talking about one oxygen manufacturing facility in each of the 36 states. Our desire is that after COVID-19, there will be other pandemics, but would Nigeria be ready when it is confronted with future health challenges? And that is our desire, to also build capacity in the areas of manufacturing. I think most of the major manufacturing companies, laboratories or companies in this country, most of them have accessed the funds that were provided by the central bank. About 150 billion was made available. I know about 3-4 that I know have accessed about 2 billion each to increase their capacity, to buy more sophisticated and modern production lines for their pharmaceutical businesses. All said and done, our desire is that after this time, we will not return to the pedestrian system that we have always used in approaching pandemics that have arisen in the past and those that are going to arise in the future. But we will create for this nation an infrastructure, a health infrastructure that will be sustainable and that will be able to provide a roadmap in the future. One of the things that we want to do is that we will leave a playbook for future PTFs, that if anything should happen, they should be able to open to page 1 and see how we dealt with the issues. Because COVID-19 came with so many variables unknown. The characteristics up till today, nobody can tell you. We are finishing with one variant, others are resurfacing as a result of the mutation of the virus, and creating all sorts of chaos to the extent that we are thinking about the vaccines that have been developed for the first variant might not work well with the subsequent ones. So those are the challenges, but I believe that at the end of this exercise, we will leave a playbook that will tell people who will come after we have all exited the scene, that in case anything arises that looks like a pandemic, these are the steps that you need to take. And I want to thank you for all that you are doing, particularly the media. This is one pandemic that has brought those of us that are on this side of the aisle and the media working together to ensure that our people get the correct information out there for them to take decisions that will protect themselves, protect their families, and by extension, protect the community. Thank you. Have a good evening.
Thank you very much. The Executive Director, National Primary Healthcare Development Agency, is inviting members of the press, particularly the OSGF press corps, for a facility visit tomorrow so as to dispel the issue of cold chain availability in Nigeria. Departure time is 11 a.m. Venue, OSGF car park, where we usually take off. Buses will be provided to allow for sitting. Both the live coverage participants as well as those in the remote, particularly the print media, are also invited. Please, if you will participate tomorrow, register at the HGF press office today. Thank you. I now invite the Permanent Secretary, General Services Office, to now give us a takeaway message. Dr. Berry.
The Chairman and the Secretary to the Government of the Federation, Honorable Minister here present, and other members of the Presidential Task Force on COVID-19, gentlemen and ladies of the press, good evening, everybody. We've been properly guided on some of the developments in the recent days. Some highlights of major issues discussed today are, one, it is no longer news that the pandemic is rising. With the escalating number of cases in the recent days, what this simply means is that we'll have a critical review of our conduct and our public life. Schools are reopening, and in this case, managers and administrators for schools have a critical role to play to ensure the safety of our children in their schools, in which case there is need for them to take all necessary measures to ensure that the basic protocols are provided and maintained in their schools. Testing, as you've been told, has proved to be more significant in our national response in the fight against COVID-19, even as the test positivity ratio is increasing. What this simply means is that all hands must be on deck. All subnationals, local governments, and all well-meaning Nigerians are advised to ensure that testing is seriously and aggressively driven. With the National Testing Week coming up, local governments are expected to test between 400 and 500 cases within the period. All segments of the society are to engage in case communication, meaning that traditional rulers, religious rulers, and of course, community leaders have critical roles to play in communicating to their wards on the danger of the rising cases in the pandemic, in which case all hands must be on deck to ensure that the number of cases are reduced through our various conducts and attitudes by ensuring that the non-pharmaceutical interventions are seriously adhered to. On the traveling note, all inbound passengers who violate the travel protocols must face disciplinary consequences. The first 100 defaulters that have been published is a case in point. So if you're a traveler coming to Nigeria, ensure that you do your tests on the 7th on arrival. Another major issue that you have to take home today is that super spreader activities like mass gathering and other congregational activities should be discouraged at all costs. All well-meaning Nigerians are advised to help in publicizing
this message. Traditional rulers, religious rulers, and of course, community leaders have very critical role to play in passing this information to everybody. And while we expect the vaccine arrival very soon, please note that the vaccine alone cannot solve the problem, and the arrival of the vaccine does not mark the end of the pandemic. So we continue to adhere to the basic measures that you've been told about. And finally, the NCDC has rolled out a new Connect code, and which is 6232, and the toll is very free. So feel free to contact that code at any point in time, and we assure you that on a very short notice, you get response from NCDC. As we retire today to meet again next week, Monday, we advise that you continue to pass the message that you've been given today to the people around you. Until then, please stay safe and have a good day. God bless you.